Okay, welcome everybody. I'm so excited. Thank you so much for coming to my workshop. I'm Joan. I am a family physician. I am a mother of two young boys and a wife of one husband. And I am a restorative medical educator and coach. And how I like to describe that is that I help humans in healthcare make their experience of their work in healthcare feel more human. Restoring humanity back to healthcare is basically my mission. You know, I like grand missions apparently. Yeah, and just so you know where I am situated, I am presenting this workshop from Treaty 4 lands, the Haldimand Tract, which is the ancestral lands of many Indigenous peoples and is also called Cambridge, Ontario in Canada. And tonight I'm going to be talking to you all about imposter syndrome. So I really enjoy giving workshops of many kinds. And when I was thinking of what my topic for my next workshop would be, this has been on my short list for some time because it's probably like the most common thing that I hear people describe just in general, in terms of a way that I think folks in healthcare describe how they're struggling. And in particular, those that are interested in my work, my podcast, come to me as coaching clients. It's a common way that people describe the phenomenon they're feeling of like, I feel like I have this imposter syndrome. I don't quite fit in. I'm always worried someone's going to find out I'm a fraud. And I relate to that strongly because something that has come up a lot, especially as I've been kind of recovering from burnout myself and finding my own way in medicine. A very common theme that my brain likes to remind me of is, but what if you're really a fraud? Or another version of it's, what if you get in trouble for being yourself, which is kind of the same thing, but in another frame. And so it's a known phenomenon, not just in healthcare, of course. Like I believe the terminology came out of work looking at like high achieving women and noticing that there was like really high, like, CEO women or like people that were in like the highest sort of levels of corporate culture. And that there was this really common psychology phenomenon happening in many of them where they were very like kind of objectively highly skilled in their field, but they felt like imposters. They felt like they didn't belong. They felt like someone was going to find out that they'd been like hoodwinking everyone. And so if any of that sounds relatable to you, then you're in the right place. Thank you for being here. So the recorded part of this workshop is going to go through a series of reflections. So I would actually invite all of you to find either a piece of paper or, if you're more like someone who likes to sit and think, like some of these questions, you don't need to necessarily scribble down an answer, but it can be nice to take notes for yourself as you're thinking. I'm also going to invite you to share some of your answers in the chat. If you would prefer to have everyone look at your answers, that's wonderful. And you can do so by choosing the to everyone menu option. And if you would prefer to share them just with me, and then I can verbalize them for you for the group without identifying you, that's also totally fine. And so then you choose from the drop down menu and you would just choose me, that I'm the only person you want to share that chat with. And then after the recorded portion is done, which will be, I think, the majority of our hour together, there will be a quick dance break, to be honest, spoiler alert, and I'll turn off the recording. And then we can have time for more open discussion without the recording, where those of us who are here live can connect with each other as well. Okay, so with that, I have a little presentation. Only my 50 billionth Zoom. Here we go. I can do it. Ta-da. Here. So, present. Aha. Okay. And someone please tell me if you can't see the slides, but I'm going to presume you can until you message me that you can't. Okay. So, I would love to know as a beginning, what scenarios in your work in healthcare bring up imposter syndrome for you? And this one I would love if you would share in the chat. I'm imagining there'll be some commonalities and then maybe some things that aren't the same for everyone. I was reflecting on it myself, thinking about what has brought up imposter syndrome for me and continues to. And it was funny, I actually recently noticed it like rearing its head again, because I've hired some wonderful nurse practitioners, one who may or may not actually be at this workshop, but I will not out who that is. And I'd shared already with said nurse practitioner, oh my gosh, I'm feeling like this sense of like, like imposter syndrome of the fact of like having people collaborate and care with me. Like I was realizing I still had these edges of feeling like, yikes, someone's going to find out that I don't know how to practice medicine. And even people I respect very much, so much so I've hired them to help care for my patients, I'm still like worried that they'll judge me. So I noticed that as I think when there's like a new set of eyeballs that may be a part of care. So a common time a lot of people tell me that it comes up is like, when they have to speak to a specialist, if you are a family physician, or if you're a specialist, maybe when you have to speak to a subspecialist, or have to speak to a specialist in a different field and where you feel like they may look down on your knowledge base. A lot of my imposter syndrome scenarios are about like not knowing enough, not knowing the answers. When patients have a lot of questions for me, then and I don't know some of those answers, and I feel pressured to like know the stats or know whatever, that I feel like, oh, I'm an imposter. Oh, a really great one is like teaching medical learners. Yes, because it's like, oh my gosh, I have to be the professor at the front of the room now. I'm supposed to have all the knowledge to impart to them. And then the really fascinating thing is I do a lot of teaching with residents, and they commonly share, not every single resident, but so many residents share that they feel imposter syndrome, which is like deeply ironic because usually the reason they feel imposter syndrome is they feel like they have to pretend to know all the answers. So like both the teachers and the learners are all feeling like they have to know all the answers. And isn't that interesting, right? And then, yes, another one, not knowing something my colleagues know. Times where you've made a mistake is a common one of like, oh, they're going to find out. Like, that's, I don't know if everyone has that as their phrase. In fact, that's actually the second question I have for you. Um, Depending on how you sort of do your internal reflection work or reflect on yourself as a human, some of us like identify more with the thoughts that our brain tells us, and really identify with sort of up here in our brains. And so then it may be easier for you to think about how what you're thinking when you have imposter syndrome. So some thoughts that I have when I know like I'm experiencing imposter syndrome, when my thoughts are, they're gonna find out, they're gonna kick me out, I'm gonna get in trouble, they're gonna figure out I'm a fraud. So I'm curious, for those of you here, what are some of the thoughts that come up for you that kind of let you know you're experiencing imposter syndrome? What are some of the thoughts in your brain? And then for others of us, you're actually more, say, body based or emotions based, where you're not sure what your brain's saying. Maybe your brain's just saying, like, ah, but you can tell emotionally, these are the common emotions I know I'm always experiencing when I am in imposter syndrome mode. So, for me, it would definitely be anxiety. That would be a big one. Shame, embarrassment, guilt, if for sure. Those are some common emotions. And so I'd love to hear yours. I'm hearing some really good thoughts from some of you. So I should know this. Oh my gosh, that is such, I just relate so strongly, fellow healthcare human, of that being an imposter syndrome experience for sure. And then another one is hurry up and practice a lot before you get kicked out and lose your job. Yes, this has been a very common theme, especially now that I've been doing more coaching work one-on-one. So getting to, have wonderful healthcare humans being vulnerable with me and sharing like, yes, these are some of my innermost thoughts that I feel like I can't share with anyone. And one of them, like a lot of us are afraid we're going to lose our jobs, which is, I mean, is just really fascinating considering like how many people are exiting healthcare. Like, I don't think we could be more valuable, literally, whether we are valued or not by our system. But like, I mean, our stock should be at a premium at this point, and yet we're also afraid we're going to get kicked out. It's such a tragedy, right? Oh, and this emotion, dripping with dread. Excuse me, that is so evocative. And I feel that in my chest and in my belly, dripping with dread, just that dread of when are they going to find out, right? And then, yeah, someone else shame. And then that black and white thinking, I actually know nothing. Like, and sometimes it like my brain just goes blank and I'm like, well, apparently I've forgotten everything I know about medicine. Like, it's just like this panic almost that overtakes me. Thank you all for sharing that. I relate to what you said strongly. So I'm stepping away from this presentation for the next section of this workshop because I want to use this beautiful box that I set up behind me, which is really going to illustrate how I think of imposter syndrome in general. So it's another case of loving if you will do some participation with me. So basically, what I'm interested in is thinking about what it is that we think, what are the qualities we think we need to have in order to not be considered an imposter syndrome. And then I'm going to use these different qualities to illustrate what I think imposter syndrome is all about. So the first question that I have for all of you is, what qualities does your imposter syndrome think you're lacking? Another way to say this would be, what do you feel like you have to pretend to be, pretend to have, like skills you have to pretend to have, or like personality traits you have to pretend to have in order for your imposter syndrome to be satisfied? So some qualities that I know I have is like always knowing the right answer. Oh, I'm realizing, yeah, good. Okay. So like all knowing is one of mine. And I wonder if that's familiar to anyone else. And then let me think. So what other qualities do folks have that their imposter syndrome, like pretend your imposter syndrome is a little monster on your shoulder. What is your imposter syndrome telling you you need to pretend to be like? What qualities, what skills, like what are you having to pretend? No mistakes. Yeah, for sure. No mistakes is a big one. Always on time. That's a big one. I'm always like, oh my gosh, how does everyone else stay on time and I can never stay on time? More outgoing. That's yes. Oh, more assertive. Yes. You also have to be like deeply compassionate and never take anything personally, not personal. I just find, you're supposed to be caring, but not too caring. Don't care too much, but also like, don't be a monster, but make sure you don't care too much. Like it's sort of like a contradictory thing. Um, I have, don't work too hard. That's an interesting, yeah. Don't work too hard. And then I have also experienced when I am in rooms with certain people where I'm not work harder. I felt both, which is kind of the clue that this entire exercise is well, you start to see the contradictions. That's sort of the point. Spoiler alert. What else did I have on my list? Oh yeah, make patients happy. Happy patients. I'll say happy colleagues. All your colleagues love you. They all respect you. The hardest worker in the room. See, yes, don't work too hard and hardest worker in the room. Bingo. That's it. Yeah, no emotions. Like don't be too emotional or too sensitive. That's another one for me. So it's like keep it together. I'm thinking that a lot. Keep it together. And just whatever this concept of professional means, that comes up a lot. I feel like the word professional is really just there to invoke imposter syndrome is something I genuinely believe. Okay, so those are some things. Thank you so much. That's so helpful. And then, okay, another question that may evoke more things is, what qualities do you possess that makes your imposter syndrome monster relieved because you feel like you actually can pass? that one might be harder to tell, but have you noticed, picture your most judgmental colleague slash preceptor. And what were the qualities that you were like, oh, great, this is going to help me get by. Oh, great, these are the qualities that are going to help me fit in. Good at figuring things out. Oops. I have a corded microphone and it's getting in my way. So I guess I'll always having a solution that can go in the box. Very well read, able to remember small details. Yes. So it's like, phew, look, I can impress people with something that whether it feels pleasant for me on the inside or not is kind of irrelevant. It's more like, look, at least it's something I can kind of impress other people with, right? I think mine is definitely just like, well, mine is happy colleagues. Like I would just be like, what version of pleasant do I need to project towards you so that you don't dislike me? Like I'm just like constantly trying to pretend to be their favorite person. It gets very exhausting. Okay. So now when we look at this list, and there's probably more, maybe like never, I would say a common time. So no patient complaints, no lawsuits. Those didn't come up, but I would say that's a common time. If you're worried that those are about to happen, all your imposter syndrome is going to come roaring out. No mistakes. Also, beyond no mistakes, like no negative patient outcomes. My lexicon is really just for me. Good luck if you can read it. But you can see there's a lot of stuff in this box. And so one thing, when you look at your version of this list, because, maybe yours will have some of these and not others, but when you think about your box, who did you learn this box from? Thinking back over, your career in medicine, your educational experience, even childhood, like who taught you what you needed to know to feel safe inside this box? When in your medical education or in your later career, like when did something like no mistakes really stick in? Like how long has that been something that if you make a mistake, you will get kicked out, you'll be discovered as an imposter, right? Where did you learn those things from, right? And then along that lines, who does this remind you of? Does this remind you of anyone? Like it's interesting sometimes when we ask ourselves who it is that we think we're trying to emulate, especially, well, this person cannot exist because they somehow don't work hard, but also work harder. They never have poor patient outcomes, make no mistakes, but they're deeply compassionate, never personal, right? So actually it's not one person, but sometimes we have a few archetypes of people. And when we think yes, exactly. Parents and preceptors. I'm actually curious how much that's true for most of you. That and maybe some really unkind clinicians you've interacted with since you've been out in practice, right? That typically these are the folks that define this box for us. And some of those people, like maybe one or two of your parents for you, or maybe some of your preceptors, you actually would consciously want to look up to on purpose, but also maybe not. Like I can think a couple of the people that really created a bit of a ouch point in me that then turned into an imposter syndrome were some of my least kind preceptors. They were the ones that I felt so much othering from, that they looked down on me, publicly shamed me in front of other clinicians, that sort of thing. And so then what my imposter syndrome is inviting me to do is to continue to impress them and to continue to be like them. They are the ones who are defining the box. I find that helpful to remember, because sometimes then you take a step back and say, yikes, why would if I'm thinking about this intentionally, why would I wouldn't intentionally be thinking of these people as my role models, but often they're the people that kind of subconsciously, our emotions and our subconscious automatic thoughts are telling us, you have to make sure you fit these qualities in order to belong, right? And so then we move to the second part of this, which is everything about you that doesn't fit in this box. So in what ways do you not fit in this box. And some of them will be the opposite, but they can also just be other qualities. Like, what feels scary about, say you had an assignment to show up completely authentically you tomorrow in your job in healthcare. What parts of you feel the most scared to do that? Which parts of you want to immediately, would you feel the most need to hide about yourself? And that would be the most vulnerable if you were actually showing up authentically in healthcare. Like some examples I can think of is, definitely making mistakes, you know. So like forgetting the fact that my brain forgets things. That's one. Um, I have kind of like a sarcastic sense of humor. I'm like not all like sometimes I can be grumpy. Maybe that seems silly, but sometimes it's not allowed, right? I don't know if you guys have other ones. Like, what are some of the things that when you think of, you know that you have to keep them hidden? Some ways to draw this out is even to ask yourself a question. What have you been told is too much by other people in the past? What have you been told by other people? That's too much. I can't really handle that quality about you. Like certainly for me, like I am quite like talkative, especially about human nature and the human self. My opinions. So just having your own opinions, having opinions, the audacity, right? But like, yeah, what your opinions actually are. Um, Another interesting way to draw out these qualities, these sort of out of the box qualities that maybe have your heart, it's hard for you to even identify because you've spent so much time really focusing on smushing yourself into this box that you're like, I don't think I have stuff outside this box, right? But if you've ever experienced someone being jealous of you, that seems like an odd one. But if you've ever had that experience, sometimes those are the qualities that are actually things that internally you would feel proud of, but that have been shamed. Um, you've been so shamed about that now you feel you have to hide because they've been appearing to hurt other people. So like, yeah, talking too much, talking with my hands too much. Some of mine are some of mine are the fact that I have a female shape. So I need to make sure I hide that and don't expose too much skin. Some of the qualities that I feel, yeah, necessary to hide is that I like have sexuality, right? Like there's sort of when you think of like, what do you have to hide? What's not allowed? What would be unprofessional for you to bring into the workplace? Like some of that, like that, some ways to consider drawing those out, right? Like what would you consider unprofessional? So we've done this exercise a bit together. If this has intrigued you, I do recommend sitting down, especially maybe the next time you have like a real bout of imposter syndrome, and really asking your brain, what do you want me, why do you want me to fit in this box? And what is it about? What qualities do you need me to start to have in this situation? And what are you afraid? What are you telling me I have to hide? What are you telling me isn't okay about myself? And kind of drawing it out this way with the notion that like all of us have a human shape. None of us have a box shape. None of us actually, it's impossible for any of us to fit in the box that our brains are telling us we have to fit in order to not be kicked out of medicine. And sometimes it's useful to really show ourselves the absurdity of that, especially if there's some contradictory things, not to beat ourselves up about it. That's not the point, but instead to show our brain like, look, brain, like, how could we even begin to fit in when literally we're moving in 5 different directions, right? Um, so I'm going back to sharing my screen here. Doo-doo-doo. Oh, did that work? I don't think that worked. Sorry, hold on. Let me try again. Oh goodness, where did it go? Oh, I know. Hee. Okay. So this exercise I call like breaking down the box, which is like inviting your imposter syndrome to speak, saying, okay, imposter syndrome, tell me everything that is supposed to be how I fit in the box. And then you identify your unique human shape by asking your imposter syndrome, what's everything you want me to hide? And that can help you map out, the rest of you. And then you notice how you couldn't ever possibly fit inside the box. You're too large. You're a full human person, right? So I'm using this exercise to illustrate the main point of this entire workshop, which is that imposter syndrome isn't a you problem. It's a system and a culture problem. The reason that we believe these things in the box isn't because we're like little silly billies that like decided to believe a bunch of random facts. The reason, like, we have been bombarded by all of these different conditions. The thing I say is that these have been, conditioned into us. We have been so like marketed and bombarded and almost like brainwashed into believing, unless we fit into this box, we will be kicked out. We will be shamed. We will be ostracized. We will be rejected by a group that we long to belong to. And as human beings, we are intensely wired to belong. It's a survival instinct because we are social creatures, right? Back in the olden days when we used to live in a forest, like the village would only be 30 people. So it would be true that if you stepped outside the sort of social norm of your 30 people, you literally could get kicked out and then have to go like live by yourself in the forest and maybe die, right? And from that time, we still have those instincts. Plus, we live in a society that has a ton of messages that prey on this fear of not belonging. Like everything that maybe is well intentioned to say, well, make sure you're not too rude, make sure you're not too angry, otherwise people might disapprove. And all these things get baked into us so that we start to think that these are true conditions of belonging we have to follow. Otherwise, we don't get to belong. So when you feel imposter syndrome, what you're actually feeling is your real and good human self bumping up against a lie you have swallowed, a lie you've been taught to believe as a condition of your belonging. So what I would say then as how we can cure imposter syndrome, if you will, I mean, really the act of like how, say, imposter syndrome would disappear from society is if society found a way to accept all humans exactly as they are. So if we all like collectively decided to do that tomorrow, then imposter syndrome would cease to exist, right? And yet here we are in this society where we're still getting all the messages like, careful you don't get sued, or, oh, did you see how Dr. So-and-so practices there, blah, 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 like all these conditions of belonging. And we're like, oh my gosh, I just don't want to be judged. I just want to belong. I just want to be included, right? So how do we cure is like a problematic word I'm just using. That's why I put it in quotes, but really like how do we start to heal internally? How do we get to reclaim our sense of self and our own sense of belonging in a world that like kind of wants us to be insecure about belonging, right? So the first thing we do is identify these false conditions of belonging and really identify them as false and really break them down. And so things like this box exercise, getting really concrete of like, okay, imposter syndrome, what's the lie that you think I have to follow in order to belong here? And then really looking at that and where does that come from? Is that something that's actually in alignment with my values? Is that something I want to believe about myself, right? And starting to break that down. And that will help. And then your body, though, still really craves that belonging and it often, like when we say we have imposter syndrome, what we're really saying is we're having the feeling of insecurity, of fear, of lack of safety. We feel vulnerable and exposed, like we could be attacked and ostracized, right? And so the way that we help our body feel less imposter syndrome is by showing it that we are in charge of our own belonging, that we can be trusted with small, real acts of self-love, self-trust, self-belief. So like times where we show up outside the box and we feel all sorts of feelings, and people may even have sorts of opinions of us, but we don't die. We still do what we want to do. Every time we do that, our imposter syndrome gets a little less. Like a concrete example, that I can share is that I have always wanted a tattoo. Growing up, I was given the message that if I was ever to get a tattoo, it would break my parents' heart. It was sort of a specific kind of religious, strict upbringing. And yet, as I grew up, I was like, I would always love a tattoo. And then I went into medicine and was also like, it would be very unprofessional to have a tattoo, blah, blah, blah. Anyways, over the past year, I got a tattoo. Can I show you? I can't even. Where's the camera? Um, I got a tattoo. And there's something about something so concrete, but something that my imposter syndrome was really like, oh my gosh, like you can't show this. Like this is going to be dangerous for you. You're going to get kicked out of medicine. Doing it anyway and just showing up after patient. Literally almost no one comments on it, guys. Like people don't care as much as we think. But that's sort of the point. Like small acts of authenticity, small acts of choosing the choice that is for you, that centers your need, saying no to the list of 10 things from the patient when you only have capacity for 3, that's a little small act of authenticity, right? So we do these small acts, and in doing so, we reclaim our sense of trust and belonging internally. And that really lessens the impact of imposter syndrome as we experience the world and all of its judgment and all of its trying to put these conditions on us, because society always will. So a beautiful way I heard this described is that all of us have been living inside someone else's imagination. Maybe it started with, say, our parents, and then we get to broader society and a bunch of how our society runs now, and the norms and ideas that prop up our society are just like a bunch of usually old white guys, like, made it up a few centuries ago, random religious concepts thrown in there. And like, here we are today, as if that's like, what, for example, gets decided as being professional or unprofessional. If you look over time, you would see that it's very much morphed, because who's imagining what is professional has morphed. As we've included, say, women in healthcare, people of color in healthcare, people from diverse backgrounds, we've had to expand the definition of what a medical professional looks like. And therefore, having our diverse imaginations at play is how we can continue to expand and imagine what we want professional to really look like. But for now, again, when we feel that imposter syndrome, that's when we're at the edge of someone else's imagination, and our reality, the real person that we are, is bumping up against that. So I want to pause and just see if anyone has questions, like put it in the chat or anything like that. And then after that, I do want to lead you all through a couple of exercises that are really kind of reflective, experiential ways to reconnect with your authentic self. I know for me, I used to not even know what I wanted to order for Friday dinner because I'd been so conditioned to just really take on the needs and wants and desires of other people and really fit into their imaginations, fit into their boxes. And it was actually kind of scary to imagine being more authentic. That sounded very risky and hard. I had to get to the point where I was like, okay, either I just start practicing medicine my own way, or I am going to leave. Like, this is getting absurd. And so something is calling you to this workshop. So maybe you're at a little bit of that point. So I just want to lead you through a couple exercises that can help resource you as you consider doing this work out in the world. Because that's how this work works. Like, there's the internal reflection part where you start to really like, oh my gosh, I'm in someone else's imagination. Imposter syndrome is a they problem, not a me problem. Oh my gosh, like I'm actually they're all just trying to manipulate me and doing what they want to do. You're like, whoa. And you're doing a lot of thinking. But the other act that actually like disintegrates the imposter syndrome and makes it way less intense is when you feel connected with yourself. And that's what this next exercise is about. So for this one, if you want to write things down, you can. Another way I would invite you to consider is actually just like closing your eyes and sitting still with yourself and like picturing and visualizing each of the questions as I ask them. I don't need you to share anything in the chat. This one's really for your own reflection, just for you. And I find it works well as a visualization kind of exercise. So if you feel comfortable closing your eyes and sitting with yourself, you can. If you do feel more comfortable writing, that's totally fine. So this is a way to just try and figure out a bit of what you want your human shape to be and discover who it really is. So I'm going to invite you to picture yourself at the end of your career in healthcare, by which I mean you haven't left because you've burnt out halfway through, but like the dream career you hope to have. Maybe it's hard to picture, but say you've gotten to the end of it and you're retiring on your terms, and you've really, this version of you has really dismantled all the conditions of belonging. You've come into your own. What would that person look like? What would that person be wearing? So like really sit and picture like this future version of yourself that's fully de-impostered, that's fully authentic, and at the end of their career and so satisfied with how they show up in healthcare every day and how they interact with patients and how they interact with colleagues. What does that person look like? What does that person wear, maybe? What does that person sound like? How frequently does that person practice? What kind of medicine does that person practice? Like whether it's a specialization or just in terms of what approach does that person take with their patients that feels maybe hard for you to access now? And just like really like picture yourself as that future person who's just completely out of the box, that's fully like living and in their full human self and is just totally comfortable in their skin, who's, had all the wisdom of many years of experience in healthcare. So we don't have to rush up to get some experience. We've got all those years of experience. And we know that any condition of belonging someone wants to put on us is real cute, but it ain't me, right? So you're kind of at that stage. So just picturing that and really like pretending and like as much as you can kind of embody or imagine yourself being that person right here. And so now being that person, imagine seeing yourself as you are now, like looking at your current self in a room together. So you are future self, fully confident, fully authentic, and you're looking at you now. So I'm like fully confident, end of my career, Joan, and I'm looking at now Joan. Half-baked, you could say. What's she doing? We can see our current self from like a distance, see how we worry, see what we worry about, see what's got us twisted up. And we have this perspective of being fully confident. And what is it that future you sees about now you? What is it that this perspective helps you gain about who you are now? And having this conversation between current you and future you. Say you had access to this like fully flourishing version of yourself in your current form, in your current day you. What do you want to share with this like mystical future version of yourself? What do you want to share about how life is stressful now? What do you want to share about what you're worried about now? What do you want to ask future self? Like what do you want to like unburden about how hard it has been, how hard it is now? What is it that you really want to say to this future version of yourself who has the answers because she's walked between now and then? And then flipping it back the other way. What does future self want to say to current self? What does she want to do? Does future self want to give current self a hug? What advice, what encouragement, what does future self have to say to current self now, who's really going through it? From the perspective of someone who knows that you're okay in the end and knows that it is fully safe to be your full self. What advice does future self have for current self? So that was an abbreviated exercise in the sense that I hope the pace was okay. if it sparked something, but you wished you'd had more time with each of those parts and each of those questions, I encourage you to watch the replay back. I'm also going to be sharing these prompts as a worksheet, so you can go through them at like fully your own pace. I find that exercise really powerful because, I mean, the trick is that that future self is already a part of you. Like, you actually have no idea what you're going to be like at the end of your career. So this version of yourself you're imagining, that's really just your full imagination. That's as far as your brain can imagine yourself now, in terms of how much better could you feel about yourself working in healthcare. It's picturing and almost having that as a kind of a goal or a dream that you could be working towards, that could make some of this work, this one small act exercise I'm going to invite you to consider, worth it. Because right now, if you're anything like even me now sometimes, but certainly me a few years ago, like I was just so tied in knots trying to meet everyone else's standards and try and squash myself into a box that I knew was literally impossible, because like the box is a black hole. Like it has things that completely contradict each other. Like you can't win. And I used to be so tied in knots about that. So if you feel tied in knots, I've been there, I get it. And so what the exercise we just did invites you to consider is what your imagination can see might be slightly possible to become in as a piece of who you are now. Your most confident, authentic self could look that way even now. It could be someone you practice putting on, practice becoming as you go into your work in healthcare. So how do you actually do that? You practice trusting your human shape instead of the box, one small act at a time. When we talk about confidence, my favorite definition of what confidence really is self-trust. It's created through trusting yourself to be authentic, one choice at a time. So every time I trust myself to say no to a patient, every time I trust myself to say yes to a slightly unusual request of a patient that's maybe not first line, but that feels authentic in terms of what I think the patient needs and what I can agree to, that is trusting myself. Every time I recognize I've made a mistake and then don't totally ream myself out, but instead meet myself with kindness, compassion, and look to see if there's something for me to learn, my body learns to trust myself more. Every time I share something vulnerable with a colleague, irrespective of how they answer back, the act of sharing is me trusting myself. Every time I take time off of work because I'm sick, and even though I feel horrendously guilty, every time I take vacation for myself, even though I've been conditioned to believe that's selfish and bad, that's another thing that could go in the box, that is me trusting myself, right? And so those are a bunch of examples I just thought of. And so my question for each of you to consider is, what is one specific authentic action that you could practice taking at work? Something that you've been trying to do, something that you've really longed to do, but have felt like, oh, it's too not in the box for whatever reason. What happens if you experiment with doing it anyway, feeling the fear, feeling the dread, feeling the anxiety, but doing it anyway? Over time, then your body learns to trust you, and the level of intensity of those emotions does diminish, because your body learns, I can keep myself safe when I do this action, when I set this boundary with patients, when I say yes or no the way I want to in an authentic way. And so when you consider whatever that action may be, maybe you're considering a list of them, but a question to ask yourself is like, what do you want to tell yourself before, during, and after when you do get scared of stepping out of the box, which you'll do, right? It's just part of our work. It's not a problem to be scared. In fact, in this kind of society that wants you to not do things, and therefore it scares you, oftentimes a signal that I'm moving in the right direction towards becoming more authentic, to becoming more confident, and therefore actually enjoying my job in healthcare more and creating a more sustainable version of healthcare for my human form. I know I'm moving in the right direction if I feel a little queasy, if I feel nervous, if I feel fear. If part of me is like, I'm not sure, I think, what would judgy colleague think of me? That's almost like a sure sign I should probably do the thing. Because whenever judgy colleague pops into my head, I'm like, oh, I'm afraid of being judged for this thing. So I check and I'm like, oh no, but I do really want to do it. It's something that I feel good about. It feels right to me and my values. Then I do it while scared. That's like being courageous, right? Doing it while scared. And I can do that telling myself that this is how it's supposed to feel. So, actually, just to say, one thing I tell myself that helps me practice more authentic action at work, that helps to release imposter syndrome, is I say, when my body's like, no, Joan, we can't do that thing because I'm scared, I say, yeah, I'm scared. That's how it's supposed to feel. These are the places where imposter syndrome is supposed to come up because it's us breaking the system and reimagining something new. Another concrete thing that really helps is thinking of what actions already help your body feel good and whole and strong and practicing those on purpose. So one of mine is like movement, like dancing and certain kinds of like cardio or strength exercises. Like doing those things help my body feel good and whole and strong. Maybe for you, it's like going out in nature. Maybe it's laughing with friends. Maybe it's having sex. Maybe it's, going for long drives in the countryside. Maybe it's watching a good show, like whatever it is that helps you feel good and whole and strong and like connects you with your body. This is actually another important piece of how you build confidence in yourself as you practice confidence building, trust reinforcing actions with your body as well as with your brain. So considering some of those as well. And that's actually the end of what I would like to record. I'm going to give us all a minute to just reflect on what we've said. And I'm going to play a song. If you, where you are now, want to move your body at all to that song, if you want to see what it's like to practice moving your body in ways just for you, even if you feel like you want to cringe, even if it feels embarrassing, those are all the ways that your body actually would love to move if you weren't being so conditioned to be afraid of staying in the box. And so if you're a hard no on dancing, please don't. And just you're all off camera, so we wouldn't know anyway. But we're going to take that, say, 5-minute break. And then after, when we come back, I'm going to turn off the recording now. And I'd love to hear from some of you who'd like to share about how this time together, what this time together has inspired in you, and what it is, what questions you have, and what you want to take with you into the coming days out of what we've talked about today. Okay, so I'm going to